Hi, my name is Kimberly Ford, and I am presenting poster number 80 titled A Review of Alternatives to Physical Guidance for Skill Acquisition in Autism Spectrum Disorder. This review looks at alternative instructional methodologies to physical guidance and some treatment recommendations for practice. This study included participants with autism and observable skill acquisition targets that could be physically guided. We looked at articles starting from January 2009 based on the U.S. Department of Education's Restraint and Seclusion Resource document published in 2012, since they started collecting data and proposing legislation against restraints in 2009. The final article count was 168 articles from 77 journals, which included 1,247 participants and 228 interventions. Overall, the highest percentage was video modeling, followed by the use of supporting alternative prompts, followed by studies that only used interventions without a teaching procedure, and then with modified prompting hierarchies with an established fading criteria, and then another category where interventions didn't fit into any of these other categories. There's some important points, but the most important I wanted to talk about is that of the 168 articles, only 6.55% compared alternative and physical guidance methodologies, which opens up future research to look at the efficiency and efficacy of these procedures. Some guidelines and recommendations that we came up with is one, not to use physical guidance without consideration. This includes individualizing instructional methods for the learner, not the therapist, and justifying why we are using physical guidance. Second, we should practice trauma-informed care by taking into consideration any past trauma a client has. Third, we should conduct social validity assessments to evaluate the preference and acceptability of the instructional method. Finally, evaluating the instructional method before adding supporting interventions to see if we need to modify and make the instructional method better. Thank you for listening, and I hope you come and talk to me at my poster. You can contact me here for questions. Thank you.